The next panelists are the interjurisdictional dynamics amongst Yukon First Nations and non-Indigenous governments during the COVID-19 pandemic. And we have Alison Perrin, Yukon University, Carrie Johnson, One Yukon.
Inkleo Shukutan, good morning. Aiji Carrie Uye, Johnson Iche, Takwakara Huninje. My name is Carrie Johnston, and I live on the traditional territory of Champlain and Ajax First Nations, and I'm a settler. I'm so pleased to be here this morning to present our final presentation, Interjurisdictional Dynamics among Yukon First Nations and non-Indigenous governments during the COVID-19 pandemic, which is a report from the Council of Yukon First Nations and the One Yukon Coalition, as well as Yukon First Nations COVID response. There we go. And I'll just wait for our slides to catch up with me. Next slide, please. So this report was authored by Rhiannon Klein, Kiri Staples, and Alison Perrin, who's here with me today to present, and in collaboration with Medea Alatini, our MC today, and myself, Carrie Johnston. Medea and I worked on Yukon First Nations COVID response, which was an initiative of the Council of Yukon First Nations that started in March 2020. Next slide. And so this project was brought forward in the fall of 2020, and the project goal was to understand the perspectives and experiences of Yukon First Nation governments and organizations, as well as other governments in the Yukon, on the interjurisdictional dynamics throughout the COVID-19 pandemic. And so very early on, we realized that we needed to start tracking what was happening to not only be a bit of a time capsule for the experience of Yukon First Nations and people, but as well as an opportunity to debrief. And so what we did was something called interaction reviews. And this came to us by way of the World Health Organization. They released some small training, next slide. They released some training modules that you could do online that taught you how to do interaction reviews. We realized there wasn't going to be an opportunity to bring everybody together during the ongoing pandemic. So how do we start doing small focus groups to gather that information and make sure that we were capturing it as we went forward, specifically with an eye towards the Civil Emergency Measures Act, which was the reason why this, or the tool that was used for the state of emergency, as well as the Public Health and Safety Act, and recognizing that neither of those legislation honor and reflect both self-governing Yukon First Nations and First Nations through the Indian Act. So participants in the interviews were mostly Yukon First Nations leadership, as well as staff working within Yukon First Nation governments. We also did interviews with key Yukon government personnel and municipal leadership. What we did was we created a massive timeline. The timeline that we used to walk our interviewees through was about 40 pages long, complete with images and all of the key details that from the pandemic. And we've synthesized that in the report that's available for you at the back. We talked about some of the key things like relationships with government, communications tools, strategy, plans that were, emergency response plans that were in place, and observations of the pandemic itself. I want to just really express a lot of gratitude to the openness and honesty with which the interviewees participated in the interviews. Walking through the pandemic as a frontline or somebody who has been in response for several years is a deeply emotional thing, and the bravery with which the interviewees accepted that challenge and were very clear and deliberate with their recommendations, advice, and wisdom. We also included all of the meeting notes from our conversations and gatherings with Yukon government, as well as caucus calls with Yukon First Nations chiefs. Next slide. The pandemic is an incredible volume of information to try to debrief. And one of the things that we first do is ask people, what is your first memory of the pandemic? And for many, it was the cancellation of the Arctic Winter Games or the cancellation of the NBA season or the Yukon First Nation hockey tournament that year. There were so many things that help sort of jog your memory and go back in time. Next slide, please. And in order to do that, we divided the pandemic into what we call our 8 stages. The first stage is sort of those initial shock first months, which we call the, we're in a pandemic phase. We're all scrambling to try to figure out what to do. And then we went into what we call first reopening, which was really our first summer living with COVID-19. Then we move into welcome to the new normal, which is when we return to school. We have our first Thanksgivings, holiday events, Christmas. And then we welcome in the introduction of vaccines, which starts at the beginning of January 2021. And then after an incredibly successful vaccine program here in the North, we move into our first real wave where we see quite a few cases come into the territory. Then we move on to rapid testing and vaccine mandates, which is that second sort of welcoming back into school and the transmission of cases that comes then. And then, of course, that giant peak is the Omicron wave, and then the precipitous drop is when PCR testing ends and we lose that as a data source. And then after the Omicron wave, we're where we are now, which is living with COVID-19. Thank you. And so one of the things that we always want to highlight is we did receive data from Yukon government from June 1 to August during that first real wave. And we did see that Indigenous people represent 56% of the cases, 63% of the hospitalizations, 56% of the medevacs, and 50% of the deaths. And as many of you guys are aware, having worked in COVID-19, the impact on the First Nation populations has been very, very disproportionate, and this data set does show that in sort of the medical side of it, but we know that there's the social and emotional side as well. Next slide, please. I'm going to turn it over now to my colleague Allison, who's going to walk through some of our key findings.
Yeah, Kiri, Rhiannon, and I had the pleasure to sift through all the information and do the data analysis, and 2 babies were born during this process. And we all survived and still managed to get it all done kind of on time. So kudos to the 2 new moms. I know Rhiannon is watching online as well, so congratulations. We had 8 key findings and 26 recommendations that came out of this. There's also a legal review policy brief that's in the final report, but also lives as a separate document. And that was created by Helena Glenn and with some advice from Darren Lees. There's also a CEMA info sheet for people who are not as familiar with the Civil Emergency Measures Act. We just wanted to make an info sheet that gave you kind of a brief overview of that. And then a condensed version of the 28-page timeline, which was still too big to print as a timeline. It's in the report, but there's also a scrollable PDF on the website that you can look at. And I just want to also acknowledge that Carrie has that timeline in her head. I can't remember what I did last week, but if you ask her, what phase did this happen and when did this happen during the pandemic, she can probably tell you and you can test her later on. It's amazing. So the first phase, I'm just going to go through, some of these results aren't really specifically from a certain phase, but I'm going to talk through some of the results and key findings as we go through the phases. So early on in the pandemic, there was a lot of collaboration. Everyone's trying to figure things out, working together. And a Yukon First Nation COVID response team was developed at CYFN. And a lot of our participants talked about Mathia and Carrie and how key and clutch they were as part of that YFN COVID response team. So Mathia was hired to coordinate between First Nation governments, YG, and the federal government, while Carrie was the main point of contact for First Nation employees that were looking for PPE, supplies, and other information. So this was really critical throughout the pandemic that we had this team at CYFN that was coordinating between First Nation governments, and it really contributed to collaboration between governments. And we found that a formal body and formal processes are necessary to coordinate planning and response amongst Yukon First Nations in a wide-scale emergency. So one of the recommendations is that be carried forward and that a formal body and clear roles and responsibilities be formalized to support relationship building and collaboration between Yukon First Nations and also with YG in emergency situations. Next slide. So early in the pandemic, there were also examples of really good relationships with the Chief Medical Officer of Health's office and Aboriginal Relations, as well as the COVID response unit at YG that supported Yukon First Nations. And those relationships were built from regular communication. So ongoing meetings, regular meetings, phone calls, personal relationships, and when things got tough, community visits. And there were champions that existed within a variety of organizations that supported those relationships. And often it was those individuals that really made that relationship happen. And what we found is that really interjurisdictional collaboration is critical for emergency planning and response. And it's very dependent on good communication and sometimes having key people that can build those relationships. Next slide, please. As well, we found that rural and Yukon First Nation communities have unique considerations that need to be considered during emergency planning and response, and I think the first two presentations really highlight that. There were examples of communities rallying together. In some towns, the First Nation and the municipality worked together to respond, building on each other's strengths. Sometimes they came together in committees with other organizations like the RCMP. So there were these examples of communities that really, rural communities that really came together and used the strengths they had in their communities. There were also some good examples of good relationships between Yukon First Nations, and people commented on how having regular caucus calls was one of the opportunities for Yukon First Nations to share information that isn't something they always get to do. So they shared experiences and approaches, and they learned from other First Nations and built off each other's strengths. Next slide, please. And of course, we had vaccines coming to the territory earlier, but there were also some challenges that showed up as well. In particular, one was a lack of access to data. And Yukon First Nations really required access to data that would let them know how vaccinated their citizens were and what age groups and who they needed to mobilize to get vaccinated. So we found that access to data was an issue throughout the pandemic. Often data was not available or was shared a little bit too late, or it is not gathered in a way that can provide the information that Yukon First Nations need. And we found that Yukon First Nations need access to data as soon as it is available, and also access to technical information in plain language. One participant, I can't remember the whole quote, but they talked about making decisions with one eye closed. And I thought that was just a really good visual of how challenging it is when you don't know what's going on within your citizens. Next slide. Okay, good. You're there. There was an eventual breakdown in the relationship between Yukon First Nations and the government of Yukon. Participants felt that YG started making decisions unilaterally, either giving Yukon First Nations very limited time for feedback, or Yukon First Nations would hear about decisions in the media. And interesting that this was happening later in the pandemic when we weren't in that crazy mode of trying to figure things out. So there potentially could have been more time to consult. And when things were crazy and everyone was moving quickly, there was actually good communication. So one example that came up quite a bit in our interaction reviews was the release of Forging Ahead, YG report, that First Nations did not have appropriate amount of time to review. They were not consulted on, so it didn't have time to give meaningful feedback before it was released. Around the same time, there was a change at the office of the Chief Medical Officer of Health that impacted Yukon First Nation relationships with that office. Up until then, they had built trust with Dr. Hanley, that he had made a point of contacting First Nation leadership personally when there were outbreaks or issues that arose, and he had built that relationship with them. So those changes kind of highlight also, sometimes it's one individual that makes things work. And so when a new person comes into a role, you have to consider how to maintain that relationship. And this highlights that relationships were often dependent on the person who was there. So considering institutional capacity to have relationships versus individual capacity is really important. And how do you bridge that relationship with the individual to the institution? We found that respect for Yukon First Nation self-determination and recognition of nation-to-nation relationships contributes to improved relationships, but this requires some coordination. And there were recommendations around training for senior leaders and administrators at YG in Yukon First Nation self-government agreements, having a liaison position within Yukon Government's Emergency Response Unit, having adequate funding for Yukon First Nations to ensure that they have self-determining control and direction over their own response. Next slide, please. Community-based testing was really an area that Yukon First Nations led. And something that we heard was that Yukon First Nations needed access to information and sometimes someone to translate technical health information into plain language. So in many cases, that was the role of the Office of the Chief Medical Officer of Health or people at Yukon government. And in many communities, community nurses played that role. So we found that the role of the CMOH is critical in supporting Yukon First Nations, but it's dependent on having a champion in the position, but also that the role of those community nurses can be very important. And of course, it was different in different communities, as the quote indicates. In some communities, there were really good relationships with nurses, and nurses even came to give technical advice to the local First Nation government. And then in other communities, there was maybe a challenging relationship, and people felt a little uncomfortable to go to the health center. So making sure that those relationships can happen with nursing centers, with nurses. Again, having that cultural training for the CMOH, for other health positions that are working closely with Yukon First Nations could improve relationship. But also just making sure that there's time spent in the communities. Damn it. I didn't see the sign. I'll just wrap up with the importance of communication again when when meetings stopped happening between different organizations, relationships fell apart. So even when you think meetings are not necessary, which I agree with sometimes, they're very important because that's how you keep an ongoing communication flow happening. And then finally, living with COVID, the last one. Just that there are opportunities for emergency response in the Yukon to reflect First Nation ways of knowing, doing, and being, including in how things are communicated or organizing events like vaccine clinics. When community strengths were used, that contributed to the success of those. And when community opinions and strength were not considered, then things were harder to succeed. There were also lingering questions around jurisdiction in relation to a First Nation declaring a state of emergency. And so there's a lot of questions around the Civil Emergency Measures Act. And participants identified the need for Yukon First Nations to be part of the review of CEMA and the decision-making process for updating the legislation. That's it.
Yay. Thank you.
Sorry.